It is 6:55 a.m. on January 4th. We just got done celebrating the long weekend for New Year's. And now I'm headed into work. It's about 36 degrees out, freezing this morning. Finally got cold in Virginia. Last year was a crazy year, which I'll totally let you in on, but I just wanted to start the new year all right and start this documentary and give you a full view of what being a pediatric oncology nurse is like for a whole year. I'm blessed to work at one of the best facilities in Northern Virginia, the Pediatric Specialists of Virginia. We take care of children with hematologic and oncologic disorders. And I've been a nurse for over 12 years now. And it's the best job I've ever had and probably the only job I'll ever have, the most rewarding career. My name is Katie Healy, and this is My Truth in 365. Hi, and welcome back. It is January 6th, and it is my day off from the clinic, so I thought I'd record a little something for you and give you an idea of my background and where I come from and what got me in the direction of nursing, pediatric oncology nursing at that. I'm going to start off that I am one of 4 kids, and my mom was an in-home daycare provider all while I was growing up. And so I've loved helping kids and taking care of kids my whole life, so I knew that I'd enter into some profession where I was helping children. When I went to college orientation at James Madison University, I kind of thought I was going to go into the physical therapy major. But then when I got there and I went and visited a couple of the different majors, nursing really stuck out to me, and at that time nursing was in high demand, so I decided to enter into the nursing field. And I'm glad that I did, because literally the next year at James Madison University there was a waiting line for people to get into the nursing program, because the profession had skyrocketed that much in just one year. So I'm very thankful that I entered into it when I did and didn't have to go to 5 years of schooling versus 4 years of schooling, because schooling is not my favorite thing in the world. I'd much rather just get out there and do it and learn that way. So I did 4 years and got my bachelor's degree at James Madison University. It was a lot of clinicals, a lot of early mornings, a lot of studying, but definitely all worth it. And I went to, I think, one of the better programs in the nation. So I'm very thankful for that. And they prepared me very well for our NCLEX exam, which I'm very thankful I will also never have to take again. Tests are not my favorite thing either. So I graduated in 2003 with a Bachelor's of Science in Nursing. I did an internship, actually I think it was an externship, between my junior and senior year in a hospital on a pediatric oncology setting, and I haven't looked back since. I absolutely love the fact that you get to see these families over and over and over. You don't just treat them once and never see them again. You develop a relationship with them, and it's a really, really rewarding career path. So I'm very thankful that I've known pretty much from the start what I wanted to do and what I want to continue to do. I started after I graduated in the inpatient setting, where you get to take care of a lot of sick kids, a lot of newly diagnosed patients, a lot of kids who are getting very difficult chemotherapy, or kids who just come in sick throughout their treatment. So I learned a lot of skills. I'm very thankful for the time that I spent inpatient, but at the same time I worked a lot of nights and a lot of weekends and a lot of holidays, and I worked overtime for about 3 years of my, I think, 4.5 year inpatient time, and it starts to wear on you, especially when you're doing night shift and you are pretty much on the exact opposite schedule as the rest of the world, and the rest of the world forgets that you are on the exact opposite schedule. Lots of phone calls during sleeping hours and things like that. So after about 4.5 years of that, I was ready to settle down a little bit and get into a better routine. And I also wanted to not lose the skill that I had, learned while in the hospital, though. So I was kind of particular about where I wanted to end up, and I made the move to go to our outpatient clinic, where we pretty much function like a mini hospital between the hours of 8 and 6:30, but no weekends, no nights, and most holidays you have off. But at the same time, I do pretty much everything that I did while in the hospital. We have some very sick kiddos that we take care of in the clinic, and then others we do need to send into the hospital just for, them to feel better and the things that they can get around the clock there. So I am now at the clinic. I've been there. We are the Pediatric Specialists of Virginia, the Pediatric Hematology Oncology Unit. There are probably about 12, 13 of us nurses now. Some work full-time, some work part-time. I've always worked full-time, and I just absolutely love it. We get 1 day off a week, so that really helps to kind of recover from the stress of what we have to deal with in the clinic. And again, it's the most rewarding job. I like the clinic because I get to see a lot of kids who are getting their treatment, but they're well enough that they don't need to go into the hospital. I get to see a lot of families that I treated at the beginning of their diagnoses, and then have done so well that, they don't come into the hospital anymore. So I get to help take care of them out of there. And then I get to see a lot of families who their child is no longer on treatment. So they have finished their treatment and they're coming in for follow-up care to make sure that they're not having any side effects of the chemotherapy. And it's really nice to be able to see all of these families and still help take care of their child long after they're done with their treatment. But yeah, that's about where I am right now. I can't wait to take you into the clinic and show you our beautiful facility and all the fun stuff that we get to do. It is a very difficult job. It is very stressful. Not so much the physical for me because I am so active and I'm used to, running 26.2 miles, marathons every year and playing sports. So the physical for me is not as much as opposed to the emotional. You spend a lot of time helping these families emotionally, dealing with some of the most difficult things they've ever had to deal with. A lot of parents express to me that they have no control over their child's diagnoses, over their care, and also a lot of them have a fear that they did something to cause their child's illness, which is never the case. So, it's not only my job to help take care of the patient, it's also to help take care of the whole family. And it's an absolutely amazing experience, but at the same time, it can wear on you after a while. So I've had to learn over my 12 years how to take care of myself at the same time, which is what I'm going to be showing you throughout this documentary. Basically how I live my life in and outside of the clinic. I can't wait to show you the fun that we have there, but also how I maintain my family life outside of the clinic and things I do for myself personally to make sure that I can go and be the best nurse I can be every single day. So I just want to thank you again for tuning in, and I'll be back soon.